May is also National Asthma and Allergy Awareness Month. The number of people with asthma in the United States continues to grow. 1 in 12 people, about 25 million, had asthma in 2009, compared with 1 in 14, about 20 million in 2001. Ed Neuzil, registered nurse practitioner at Allergy, Sinus and Asthma Family Health Center, explains how asthma and allergies often go hand in hand.
If it's an allergy-induced asthma, there's different things you can do, such as environmental modifications. If we know that allergies are a trigger, and we know that the allergies are prevalent at this time, you try to reduce the amount of outdoor exposure if you can. And this isn't always something that people can do, but you try to avoid the trigger. So one of the keys is, if I know that I'm allergic to tree pollen, and in the springtime the tree pollen is prevalent, you would want to really try to think about not being outdoors as much during those times. Make sure you keep the windows and doors closed. This is the type of weather that everybody says, well, I want to air out the house. There's no such thing as airing out the house. What you're doing is letting all the contaminants and pollens in the house. You need to keep the doors and windows closed. You need a good HEPA filter on your air conditioning. You have to practice the environmental modifications. If they're outside for a period of time, you can't stay indoors all the time. You're going to be outside. Think about the fact that if the pollen's on the car, it's on the back porch, it's on the furniture, you've been outside for a while, it's on you. I don't care if you're sitting at a picnic and you don't even get sweat. The pollen's on you, you're dirty. And so in the evening time, you take those clothes, they have to go in the laundry. You need to get a shower, you need to rinse out the hair, you need to rinse out your eyes, rinse out your nose, because these are the areas where pollen can collect. The reason I say the eyes is because in the eyes, for those people that suffer the ocular symptoms, the pollen is right in that moist environment, and you have certain cells there called mast cells that will then react, and that's where these individuals get those red, itchy eyes. So just using an over-the-counter saline type solution when you come in can definitely help reduce that exposure. Using a nasal spray to rinse the nose is something that you can do to rinse the nose, and definitely rinse out the hair. It makes a big difference. By just practicing some of these environmental modifications, you can greatly reduce your symptoms when it comes to asthma.
You'll find contact information and more about allergies, allergy testing and treatments at the Allergy, Sinus and Asthma Family Health Center in Lady Lake when you visit the Asthma and Allergies story link at yourhometownhealth.com.